If you're dealing with red, swollen, or itchy eyes, you are likely experiencing the miserable effects of allergic conjunctivitis, also known as pink eye. While over-the-counter drops are common, many people are looking for natural ways to calm the inflammation at the source. In this video, we are counting down 10 proven home remedies to stop pinky eye and eye allergies, ranked by their quantifiable clinical impact. Before we begin, we need to cover some important safety and red flags. So, if you experience severe eye pain, sudden changes in vision, sensitivity to light, or discharge that is thick and green, do not rely on home remedies. These are signs of infection or other serious conditions that require urgent medical attention. This video is for education only and is not medical advice. Always talk to your doctor or qualified health professional about your own situation. Now, let's begin our countdown with the top 10 ranked tips to stop eye allergies and pink eye. Coming at number 10 is nasal irrigation with saline. While this might seem focused on the nose, the eyes and nose are connected by a reflex arc. Research shows that flushing out mucus and allergens can calm neurogenic inflammation in the eyes. In a meta-analysis, saline irrigation provided a 27% improvement in symptoms and allowed patients to reduce their medication by 30%. You can use an neti pot or squeeze bottle with distilled sterile water and a saline packet to flush the nasal cavity daily. Number 9 is the use of HEPA filters. Environmental control is a critical first step. High efficiency particulate air filters, HEPA, remove over 99.97% of airborne allergens like pollen, dander, and dust. A multi-center randomized trial demonstrated that using an active HEPA filtration in the bedroom reduced the need for allergy medication by 33%. Another study on wearable purifiers showed a 49% reduction in total symptom scores. To get these results, run a HEPA filter in your bedroom continuously, especially during high pollen seasons. Number 8 is increasing your intake of omega-3 fatty acids. Found in fish oil or algae oil, EPA or DHA compete with the inflammatory chemicals that cause swelling. In a placebo-controlled trial for ocular inflammation, basically eye inflammation, the group taking omega-3s achieved a symptom reduction score that was approximately 400% greater than the placebo group. It works by reducing the production of pro-inflammatory mediators, though it may take a few weeks of consistent supplementation to feel the full benefit. Number 7 is Ectoan eye drops. I'm not sure if I pronounce it right. So Ectoan is a natural molecule produced by bacteria that survives in extreme conditions. When applied to the eye, it forms a water shell barrier that stops allergens from touching the surface cells. Clinical data shows that a 2% Ectoan solution can reduce total ocular symptom scores by nearly 46%. It is preservative-free and safe for daily use, acting as the shield against the environment rather than a drug. Number 6 involves your gut health. Probiotics, specifically strains like Lactobacillus acidophilus, which is basically the good old yogurt strain, can balance the immune system so it stops overreacting actually to harmless pollen. In a study targeting allergic diseases, this specific probiotic strain reduced eye symptom scores by approximately 58% compared to placebo. By modulating the immune response from the inside out, probiotics offer a systemic way to manage chronic inflammation. Breaking it to the top 5 is MSM or methylsulfonimethane. Again, sorry for the mispronunciation. So, this is naturally occurring sulfur compound that inhibits the NF-κB pathway, which is a master switch for inflammation. A randomized double-blind study found that taking 3 grams of MSM daily reduced itching eyes by 65% after just 14 days. It was also shown to significantly reduce watery eyes and sneezing, making it a powerful tool for stopping the allergic cascade. Number 4 is correcting a vitamin D deficiency. That's a big one. Vitamin D is a hormone that regulates the immune system, and low levels are strongly linked to severe allergies. One study showed that 92% of patients with severe conjunctivitis were vitamin D deficient. Correcting this with supplementation led to a massive 71% reduction in total symptom severity. It is best to get your blood levels tested by a doctor to determine the right dose for you. Also, of course, consider getting regular exposure to the sun. This is a natural way to get vitamin D, and personally my preferred way to do so. Number 3 is quercetin phytosome. Quercetin is a bioflavonoid found in onions and apples that acts as a natural mast cell stabilizer, preventing the release of histamine. However, regular quercetin is hard to absorb, so look for phytosome technology. A clinical trial using this specific formulation reported that 100% of subjects experienced a restoration of their ocular symptom scores to baseline values. Wow! So it is also significantly improved tear film stability, helping to soothe the eye surface. Number 2 is the simplest immediate fix, cold compresses. While it does not change your immune system, the impact is undeniable. In a pollen challenge study, applying a cold compress for 5 minutes was the only treatment capable of returning ocular symptoms to baseline within 1 hour. Effectively, again, 100% recovery from an acute flare. The cold constricts blood vessels to stop redness and numbs the nerve endings that cause itching. And finally, drum rolls. The number 1 ranked remedy is butterbur extract, specifically the ZE339 formulation. This herbal extract blocks leukotrienes, which are inflammatory chemicals 1,000 times more potent than histamine. In multiple head-to-head trials, this exact formulation demonstrated an impact of roughly 80% reduction in symptom burden, performing statistically equal to prescription antihistamines like cetirizine, but without the sedative side effects. Crucially, you must only use extracts labeled as PA-free to ensure they are safe for the liver. So now, to recap, for the best results, consider combining an environmental control like HEPA filters, a daily preventative like butterbur or vitamin D, sun exposure, and an immediate relief tool like cold compresses. Remember These measures support your health but do not replace your doctor's advice. Now, if you like these rankings and you find them helpful, please hit that like button and subscribe to Anai for more natural health breakdowns. Do you have any tip that helped you stop these allergies? Share it in the comments below to help others. Thanks for watching and see you on the next video.